Bloomington Mayor John Hamilton back with you. Thanks so much for being with us. And today we have a really exciting update about what's going on in the Bloomington Fire Department. And we have McKenna Terry and Shelby Wood with us today, two pretty recent employees with the fire department. And we're going to be talking about the Mobile Integrated Health Program. And so first of all, let's remember mostly what firefighters do is respond to 911 calls, emergencies. They do some fire prevention work a lot, but also the 911 calls are basically responding to fires or health emergencies. And you're new and you're doing things a little differently. So why don't you just tell us a little bit about what's different when you guys respond to a 911 call?
Yeah, so our program is Mobile Integrated Health. And we are a patient-centered care model where we get to meet our patients where they are. So sometimes that's in home, sometimes that's in a facility, and sometimes that's on the street. But we get to meet them where they need to be met, and then help coordinate the care that they're gonna need further to prevent further 911 calls that are maybe non-emergent, but also help gap that continuity of care.
So I think of firefighters, most of us do, is the bell goes off, 911, they run out, they fix a problem, they put out a fire, they help somebody in crisis. But you guys, you still do respond to 911 calls sometimes, is it? Or you mostly do things before or after, McKenna?
It's the before and after.
Before and after?
Yeah.
And what do you do?
We will go out to their house and visit with them and see where those gaps are and see what they're needing as far as how their needs need to be met.
So this might be people who have frequent 911 responses, is that right?
Yes.
Often?
Yes.
Okay. So it's kind of, many people don't know that 911 fire department, often what they respond to are health calls. Anyway,
Absolutely.
right? Not just fires. Fires is a little piece of what they do. So tell me about what you were doing before and then what made you apply for this job, if you would. Maybe Shelby, let's start with you.
Yeah, so I got my EMT in 2020, but I have spent the last 5 years working as a victims advocate for a prosecutor. So I applied for this job because it really had my name written all over it. I not only get to utilize my EMT here, but I get to utilize my human services degree. So a big part with EMS is that, you know, you're responding to a call and then not maybe necessarily seeing what happens afterwards, right?
It's emergency. You
Right,
just
it's
go and
emergency,
leave.
right. So here, we not only get to do health assessments and that sort of thing, but we get to see it through, and we make sure that they get the help they need long-term instead of just respond emergency.
Right.
So it's fantastic, I love it.
Right. And since October?
Oh yes,
McKenna,
I've been doing it since October.
Just a couple months. And McKenna, you, what were you doing?
I was an EMT for 6 years prior,
Okay.
both intercity and rural EMS.
Riding an ambulance?
Yes, loved
Okay.
it. I came from a 24-hour on, 48-hour off service. I have a little girl, so the scheduling was not really there for me to be home
Yeah.
with my family
Yeah.
like I wanted it to be. So I seen this job posting and it was like, okay, this is a different avenue of what I'm doing. I could really love it. And so I kind of jumped in full force and been here
How's
ever
it going?
since. It's
Okay.
going really good.
So you are a team.
Yes.
You generally
She
go
has
together.
the best partner there is.
Yes.
I'm just kidding. I have the best partner there is.
It's really interesting. Our fire department, our public safety overall keeps evolving. Like we added police social workers and community
Which are
service
fantastic,
specialists.
by the
Do you
way.
work? Do you interact with them?
Yeah, they're
do.
great.
Yeah, so it's kind of this sense that in between the sworn officers of police and the sworn firefighters, there's a lot of work that can be done, and you're really focused on that healthcare side, I guess. And so
Yes.
maybe, is there an example of what you've done in a typical day? Maybe there aren't typical days, but just some stories of what you've done since you've been here.
Yeah, so we actually spent our day yesterday responding to calls that were initially with our fire department lift assists, right?
Okay,
So
lift assist, somebody
lift assist,
fell
someone
and
who
then-
fell,
Yeah.
but they don't necessarily need EMS,
Yeah.
right? They just need help being picked up.
Yeah.
So our firefighters had ran several times to this
To the
residence.
same place.
Right,
Lift
and
them.
right, and when we got there, obviously our initial thought was, okay, how can we prevent falls, right?
Yeah.
We're here for lift assist. But when we got there, we realized that this couple really needed much more than just fall prevention, right? So they needed some basic needs like help bathing, help with food.
Yeah.
So we're getting to actually help coordinate that care so that we're not just going to help pick them up, right? We're helping with their quality of life.
And
So
then
we love it.
And you follow up
Yep.
with them, and it also, the goal, I suppose, is that they have to call less often to 911.
Yes. And we already are seeing that. So on our,
You track that kind of thing, like how,
yeah, so, and it's actually our fire system, we get to see how many times we've run on somebody. And then it's very clear when we've got to step in and we're
Yeah.
not running as often,
Yeah.
right? We never want to detour someone from calling 911 if they need it,
Yeah.
right? But if it's a non-emergency situation where we really don't necessarily need 911, we want to try to help step in to prevent those calls.
They can reach out directly to, with
Correct.
not a 911, maybe we can let people know how to do that.
Yes.
McKenna, do you have any surprises or things that struck you that people might be interested in the job?
I was really happy to be able to support the sworn service members that are in there, because this whole program, another big thing for it is to lessen the burnout. The less they are going to the same addresses, hopefully the more they are wanting to stay and do the job.
That's really interesting, because I know firefighters are in the work to help.
Absolutely.
And it probably is kind of frustrating if you feel like you're going
Over and
over and over, and while you're helping the emergency, you're not,
Right.
maybe they're not advancing the way, and you guys can help do
Right.
that.
And,
Yeah.
and they do a great job of doing their job.
Yeah. Yes.
It's not their job to do the human service work, right?
Right.
That's
That's
why
right.
we exist.
It's like the police social workers and community
Exactly.
service specialists, kind of that integration of stuff. I know you mentioned, I know you've worked with the Stride Center and other places
Yes.
from that group, so that's really important. I think it's useful for people to know too, we're trying to figure out, this is healthcare work, and we're trying to figure out, can we get funding? I know there's a grant application pending, but also it's just thinking about how do we get integrated in the health system a little better too, right?
Right. So the ultimate goal at this point, we want to work on help with things like help prevent readmits at hospitals,
Yeah.
right? We want to help people that are dealing with some chronic disease and overall healthy living, right?
Yeah.
So the goal is to eventually help mitigate that burden, that financial burden on maybe the healthcare system,
Yeah.
because we're already stepping in and working on preventative programs. So eventually, we're hoping to get to the point where we get to work with health insurances and that sort of thing, so that we have a sustainability plan.
That's all that bureaucracy stuff,
Yeah.
and paperwork and all. But listen, I'm looking at your shirts. I'm so proud you're both wearing the City of Bloomington Fire Department
Yes.
shirts. It is so great to have you part of the department. This is the top-ranked ISO 1 ranked fire department in our City of Bloomington, and it's just really refreshing to hear about how it's continuing to evolve and improve and help our community live better lives. We thank you so much for what you do, and
Yeah, thank
good
you.
luck. And if you want more information, we'll share that on the screen, and look for McKenna and Shelby out in the field sometime. And thanks so much for what you do.
Thank you.